of difficulty, including poor infrastructure, harsh climatic conditions, insecurity, and lack of basic amenities. Regrettably, the hardship allowance remains uniformly applied despite these disparities. Honorable Speaker, it is against this backdrop that I seek a statement from the chairperson of the Departmental Committee on Education on the following. 1. The reasons for the failure by the Teacher Service Commission to classify Isiolo municipality under Cluster 3 for house allowance, despite the clear eligibility of the listed schools. Secondly, reasons as to why the hardship allowance remains uniform across all hardship areas, despite the wide differences in actual hardship severity. And finally, steps being taken by the government to implement a graduated or clustered hardship allowance model to ensure fair and equitable compensation for teachers serving in the most challenging areas. I thank you, Honorable Speaker.
Is there the chairperson for the Departmental Committee for Education or a member? Are they present to give an undertaking? And majority leader and minority are not here. Okay, I think Honorable Pukose, we shall let you inform Honorable Melly. Okay, thank you.
Thank you, Honorable Speaker. I'll inform the Chair of Education, the Honorable Melly. He normally sits with me here.
Okay. All right. Then, Honorable Members, allow me to reorder the order paper in this respect, that we move to order number 8, and then we shall come back to the responses to the statements that had been placed before the House earlier. So let's, next order.
Order number 8, motion, implementation of the universal health coverage and policy on mandatory use of public health care facilities by public officers. Question to be put.
Honorable members, I now put the question that aware that Article 43(1)(a) of the Constitution provides every person has a right to the highest attainable standard of health, which includes the right to health care services. Further aware that the government committed to accelerating attainment of the universal health coverage, UHC, to ensure that all Kenyans have access and receive essential quality health services. And cognizant of the fact that the 2020, the Ministry of Health adopted the Kenya Universal Health Coverage Policy 2020-2030 with the theme, accelerating attainment of universal health coverage. Honorable Bowen, please be silent. Accelerating attainment of universal health coverage, which is currently being implemented through the introduction of the Social Health Insurance Fund, noting that there is need to increase the quality of care and services provided in the public health sector. Concerned that the public health care services lack adequate funds to guarantee quality health care services, and further noting that the civil servants, public servants, and state officers are accorded a comprehensive medical cover by the respective government agencies, and appreciating that the use of the comprehensive medical cover by public officers and state officers in public hospitals would guarantee sufficient funding for public hospitals. This House therefore resolves that the government through the Ministry of Health implements the Kenya Universal Healthcare Coverage Policy 2020-2030 and introduces a policy on mandatory use of public health care facilities by all civil servants, public officers, and state officers in the country. Will as many as of that opinion say aye? Aye. Will as many as of the contrary opinion say nay? Nay. The nays have it. Honorable members, we now go back to order number 7, and we have about 5 statements to be responded to. The first one is a statement by Honorable Stephen Mogaka, member for West Mukiriango, to be responded to by the chairperson for the Committee on Administration and Internal Security. Okay, we give a little time to, we'll give Honorable Tongoyo, do you need some time? Okay, so let's move to the next one. Then we'll come back to you. Let's then go to the next response to the statement made by Honorable Dr. Charles Onchoke, member of MP for Bonchari by Education, Chairperson Committee. Anybody from Committee on Education? Yes, Honorable Professor Barton.
Thank you, Madam Speaker. I have the report on from response to Dr. Onjoke, and Madam Speaker, let me present. Honorable Chair, drug and substance abuse is rampant among university students in Kenya. An estimated 26.6% of students across both private and public universities are currently using substances such as alcohol, tobacco, cannabis, and psychoactive substances, especially methamphetamine, ecstasy, and ketamine. Alcohol was the most abused substance, 87%, with one followed by cigarettes at 64%, shisha 41%, vape, e-cigarettes 31%, nicotine 30%, kuber 23%, and snuff, tobacco 22%. Question 1 was actions being taken to address drug and substance abuse among university students in Kenya. Universities are implementing multifaceted interventions to address drug and substance abuse. Universities are collaborating with National Authority for Campaign Against Alcohol and Drug Abuse, that's NACADA, to implement education and communication campaign to create public awareness on dangers of substance abuse, preventive mechanisms, and rehabilitation programs. The universities have also introduced regulations and policies that ban alcohol and substance use on campuses. Counseling services and basic treatment is offered to students who face challenges with substance abuse. Universities are also engaging the families of the affected students to support the students by providing an enabling environment for treatment and recovery. Question 2 was on the plans put in place by the Ministry of Education to provide affordable and accessible treatment and rehabilitation services, specifically tailored to meet the unique needs of the students in institutions of higher learning. The response is that the Ministry of Education provides policy guidelines and funding for university programs and policies that include drug and substance abuse. Therefore, the ministry has delegated welfare of students to universities while providing oversight and strategic leadership. University policies foster the welfare of students. Specifically, a committee on drug and substance abuse has been established in every public university to manage relevant programs, monitor and report the progress made to the ministry. In this regard, universities implement and report on various interventions that address drug and substance use. Universities are also required to commit resources in their budgets for essential health services such as counseling and a unit